Dr. Kate Tulenko joins me now. She is the CEO of the global health firm Corvus Health. Kate, thanks so much for coming in. Let's start with some statistics here. More than 700 cases of measles so far in the U.S., 25-year record high. Worldwide, the World Health Organization says cases so far this year, as we mentioned, up more than 300% from this time last year. The question is, how much worse can this possibly get at this point?
Well, unfortunately, we probably can expect it to get worse. And the problem is that there are pockets of communities and people in wealthy countries that haven't been vaccinating their children. This is what's called vaccine hesitancy. And some people don't vaccinate for religious reasons, and some people don't vaccinate over a fear that the vaccination might be linked to autism or other disorders. And that has been completely discredited. In fact, the British physician who published a paper about that has had his medical license revoked, and multiple very large studies have been showing there's no link. But because you have these communities where the vaccine rates for measles are 83 or 85% or lower, they're really ripe for measles epidemics, unfortunately. And what we're seeing now, really for the first time, is a connection globally of all the outbreaks that, between Ukraine and Washington State, or between Israel and New York. And I think we can unfortunately expect to see a lot more of that.
And you mentioned the lack of people getting vaccines, but also some of these countries don't have vaccines available because there's no infrastructure to distribute these vaccines. That's also a problem.
So yeah, unfortunately, a good example of that is the African country of Madagascar, where in the last year, over 115,000 people have gotten measles and over 1,200 children have died due to measles. And yes, they don't have the primary care infrastructure to get children vaccinated. And unfortunately, because these children are malnourished and they don't have access to good health care once they get measles, the mortality rate is very high.
So what are efforts being done to get those kind of vaccines to these particular countries then?
So certainly, WHO and the national governments are working very hard to get the vaccines out. But they have extreme infrastructure challenges, like lack of transportation, often language difficulties, and often in some of these isolated communities there is mistrust as well regarding the vaccines.
Now, typically, as you know, we get our shots when we're very young. So would you suggest for adults to get booster shots?
So the CDC is suggesting that if adults either don't know they were vaccinated or unsure that they can get vaccinated for measles, or you can also get your antibody level checked. For example, I, as a physician, recently had my antibody levels checked to make sure that they were high enough. And if they're too low, you can get vaccinated again.
Now, when you get these shots, typically you get them for not just measles, typically, but rubella and mumps.
Yes.
So can I ask, how come we're not seeing more cases of these other diseases?
Because they have mainly been eliminated. Measles is one of the most highly contagious diseases there is. It's a virus, and the droplets can be airborne for up to 2 hours. In fact, the CDC says that if you go into a room in which someone with measles was there, 2 hours ago, you can still catch it. So that's really the reason we see measles more than mumps and rubella.
And that definitely plays a role when we're traveling and we're on a plane. I can imagine that being a problem.
Yeah, there was a huge scare last week when there was a stewardess who had measles, and you think of that enclosed cabin and the fact that everyone was affected. And it's in many ways the same with that cruise ship. Very enclosed space, usually only 1 or 2 dining halls, and so the risk is quite real there. And I imagine that many of those people end up being quarantined for 2 or 3 weeks on the ship.
So vaccines, definitely a must. Any other precautions that we can take, besides the vaccines?
Certainly, good hand washing. If you have an infant that's too young to be vaccinated, people are now starting to vaccinate infants as young as 6 months. But if you have an infant younger than 6 months, keeping them away from crowds, making sure you know the vaccine status of anyone who has contact with them, and of course, adults getting the vaccine as well. These are the things you can do to protect yourself.
All right, Kate Tulenko, CEO of Corvus Health. Thank you so much for your perspective and for coming in.